Hello, my name is Da-sha and I'm the Program Supervisor for the Prematurity Prevention Initiative at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you for watching today's pre-recorded chronic illness and disease presentation, which will provide information on various chronic illnesses and diseases that can impact the pregnancy. Following the presentation, Jessyca Ramos, the Director of Nursing for Region 2 for the Family Connects New Jersey program at the Partnership for Maternal and Child Health of Northern New Jersey, will be joining me for a Q&A session addressing questions regarding chronic illnesses and diseases that can impact a birthing individual, along with ways a person can learn more about their health history and advocate for themselves. This presentation is also in collaboration with the Greater Newark Healthcare Coalition and the AIM-CCI Newark Maternal Safety Work Group. So agenda, what we'll be covering during today's presentation. I will be going over the Prematurity Prevention Initiative, covering what the program entails and offers, going over what is a chronic disease, covering the chronic diseases across the state of New Jersey, going over chronic diseases by their topic, providing ways to manage chronic disease, offering tips for a healthy pregnancy, and then concluding today's presentation with resources. The Prematurity Prevention Initiative, also known as PPI, is a collaborative cross-sectional effort aimed at focusing community engagement on available evidence-based interventions aimed at reducing premature birth rates in New Jersey. Guided by data, New Jersey's Prematurity Prevention Initiative focuses on supporting the diverse landscape of mothers in New Jersey who have premature birth experiences or demonstrate a motivation to prevent early birth experiences from occurring. So premature or preterm birth rates in New Jersey. So in 2022, there were 9,542 preterm birth rates in New Jersey, representing 9.3% of 102,890 live births. In 2022, 1 in 11 babies were born preterm in New Jersey, and Black infants are nearly 2 times as likely as white infants to be born preterm. So a chronic disease. A chronic disease is a health condition that lasts for 1 year or more that needs ongoing medical care, also referred to as a chronic illness or condition. A few examples of a chronic disease include heart disease, high blood pressure, preeclampsia, diabetes, and obesity. So this slide covers the chronic diseases in New Jersey based off of county and looks at Northern County specifically. As you can see, this one provides data for Bergen, Essex, Hudson, Passaic, Sussex, Union, and Warren counties, and provides the rates of the amount of women 18 and up that had percentages of chronic disease. So in Essex, Hudson, and Passaic, we see that women 18 and up had high blood pressure rates from 2011 to 2021, Essex being 30%, Hudson having 28%, and Passaic having 27%. For women 18 and up with diabetes from 2012 to 2022, In Essex County, there were 10%, and in Hudson County, there were 10% as well. And for women with diabetes 18 and up from 2012 to 2022, in Essex County, they had 32%. In Hudson, it was 26%, and in Passaic, there was 27%. So we see the increase of percentages for chronic diseases that are impacting women 18 and up, addressing high blood pressure, diabetes, and obesity. So according to the most recent report from the New Jersey MMRC, the PRMR for Black non-Hispanic women is 6.6 times higher than for white non-Hispanic women. The PRMR for Hispanic or Latino women is 3.5 times higher than for white non-Hispanic women. So the state PRMR for all races and ethnicities is 14.4. So it's important to address chronic disease, and it's one step at preventing pregnancy-related deaths. So tobacco use in chronic disease. Tobacco contains an addictive drug called nicotine, and is very addictive, and its addiction affects self-control and the ability to want to stop smoking for individuals. 90% of smokers start smoking before the age of 18 years old. And smoking from tobacco contains more than 7,000 chemicals, over 70 causing cancer. Smoking contributes to the four top leading causes of death, including heart disease, cancer, chronic respiratory disease, and stroke. So it's important to, be mindful of smoking, especially during pregnancy, as smoking does contribute to four leading causes of death. So, risk for individuals who smoke. So, anyone who smokes is at higher risk for reproductive health problems, a delay or inability to getting pregnant, could experience pregnancy complications, could have irregular menstrual cycles or early menopause, and have a damaged immune system. So, smoking in children, for mothers who smoke during pregnancy, they're increasing their baby's likelihood of being born premature. Baby being born with birth defects such as cleft palate, lips, or club foot. The baby is at higher risk of experiencing a low birth weight and death before birth, which can be a miscarriage or a stillbirth, and also is at higher risk of having SIDS, which is sudden infant death syndrome. So now we're going to go over a few of the chronic illnesses and diseases. So what is high blood pressure? High blood pressure is the force that pushes against your blood vessels walls, which each time your heart pumps and relaxes, sending blood throughout your body. So doctors use your blood pressure rate to monitor your heart health during your pregnancy. You may hear the term hypertension used when talking about a very high blood pressure during pregnancy. So on this one slide, you can see the blood pressure ranges. So a healthy blood pressure is less than 120 systolic, and for diastolic, it's less than 80. And as you can see, the elevations increase, indicating the blood pressure ranges. So the higher the blood pressure goes, you can see the hypertension in crisis is when the blood pressure systolic is over 180. Okay, pregnancy and hypertension. So chronic versus gestational hypertension. Chronic high blood pressure is that a person has before getting pregnant or that develops in the first half of the pregnancy before 20 weeks of pregnancy. Gestational hypertension is high blood pressure that is diagnosed after 20 weeks of pregnancy. Hypertension during pregnancy can cause stress on both your kidneys and your heart and trigger heart disease, kidney disease, and potential stroke. High blood pressure during any stage of pregnancy increases the risk of preeclampsia, preterm birth, placenta abruption, and a cesarean birth. Preeclampsia. Preeclampsia is a condition only seen in pregnant individuals and typically happens in the second half of pregnancy or soon after childbirth. High blood pressure is a key indicator of a high risk for preeclampsia. In some cases, for individuals with preeclampsia, early delivery may be necessary. So managing preeclampsia, it's important you and your OBGYN should talk about your condition and how it will be managed. The goal is to limit complications for both you and your baby to ensure you have a healthy delivery. So measuring your blood pressure during pregnancy is important, and your OBGYN should check your blood pressure at every prenatal care visit. Managing hypertension. So seeking medical attention is important. Making sure you schedule an appointment with your doctor for any consultation you see, and if you need any medication or managing your hypertension is very important. Incorporating physical activity is recommended. It's recommended to do at least 30 minutes a day of any physical activity. 5 days a week of physical activity. Make sure to address this with your provider to ensure that they're aware of the physical activity you're enduring, such as walking, is a great exercise. Incorporating healthier food habits. Develop a reasonable healthy diet before, during, and after your pregnancy, and increasing your water intake is very important as well. You can talk to your provider about healthy ways to adjust your diet, and your doctor may also recommend a potential nutritionist or dietitian. Diabetes. So diabetes occurs when the body has too much sugar, also known as glucose, within the blood. Some women have diabetes before pregnancy, which is pre-existing diabetes, and there are three types of diabetes to be in the lookout for. type 1 diabetes, type 2 diabetes, and also gestational diabetes. So this gestational diabetes is the type of diabetes that only occurs during the months of pregnancy. If you think you may have gestational diabetes, it's important to report any signs and symptoms to your OBGYN early. If you begin to develop gestational diabetes, it's important to create an effective plan of care with your physician. So, women with untreated gestational diabetes are also more likely to develop type 2 diabetes within the near future. So, it's very important that if you're experiencing any symptoms to address them with your provider. So ways to manage gestational diabetes. Eating a variety of small healthy meals throughout your day can help manage gestational diabetes. Paying attention to the amount of carbohydrates and fats and proteins you are eating throughout your day is also very important. Maintaining a physical activity during your day, such as walking, can be also a great way to manage gestational diabetes. And paying close attention to your glucose and your sugar levels. So ensuring you're paying attention to the amount of sugar you're taking is also very important during pregnancy. It's important to avoid high sugary foods like fruit juices or fountain sodas, and any high sugary dessert can be very important with managing gestational diabetes during pregnancy. So Black women are severely affected by diabetes in New Jersey, and Black women are 4% higher compared to their counterparts. So diabetes can cause problems during pregnancy, such as preeclampsia, and systemic racism contributes to these racial disparities in New Jersey's chronic disease rates. So Black women are more severely affected by diabetes in New Jersey, and the disparity has presented from systemic racism contributes to racial disparities in New Jersey's chronic disease rates as well. And over this slide, we can see the different rates across the years for Black women and other racial women. So obesity and pregnancy. Obesity is recognized as a body mass index BMI of 30 or greater. Obesity during pregnancy can increase the risk of hypertension, which can later turn into preeclampsia, gestational diabetes, and the need for a cesarean birth. Obesity during pregnancy can also increase the likelihood of a preterm birth, as well as your child developing any neural tubule defects. So obesity can cause problems during pregnancy, such as preeclampsia, and again, systemic racism contributes to these racial disparities within New Jersey for chronic disease rates. And we can see the percentages for women between the ages of 18 to 44 with obesity. Again, this slide looks at the severe effects of obesity in New Jersey and the disparities, along with systemic racism and how it contributes to the racial disparities in New Jersey, addressing chronic disease rates. And this also looks at the rates and percentages from 2012 to 2020. All right, summary. So tips for healthy pregnancy. Your prenatal care provider can help you manage your diet and activity, or your active lifestyle, and help contribute to a healthy pregnancy to keep you and your baby safe. So building a regular and strong relationship with your doctor is very important. Scheduling any and attending your prenatal appointments so that you can talk with your provider about your concerns, asking your doctor about what to eat during your pregnancy, and increasing your physical activity can help manage weight gain throughout your pregnancy. Also, talking to a nutritionist for additional support can be helpful, and asking your doctor for a referral may be necessary if you're concerned about your healthy eating or potential diabetes or obesity during your pregnancy. And it's important that you get to enjoy your pregnancy. So taking advantage of all of these tips can help you ensure that you have a healthier pregnancy outcome. So these are some resources that are provided for the Prematurity Prevention Initiative. We offer free educational resources and presentations such as the one I provided today. You can visit our website, enjoypreterm.org, for more information and downloadable toolkits and resources if you're ever interested in more information. The PPI program, also Prematurity Prevention Initiative, sends out quarterly newsletters that you can sign up for and receive. We also have social media on LinkedIn, Instagram, and Facebook. We also have BIM task force meetings that you can contribute or participate in. We have our maternal experience survey. PPI also attends community events and outreach. And for providers, we also have PPI Go kits and NICU kits that are available and free that you can provide to your patients and clients. Also on our website at njpreterm.org, you can download free chronic disease fact sheets that are available in English and Spanish. This is what they look like, and they provide a little more information on the various chronic illnesses and diseases that can impact the pregnancy and provide tips on ways to manage them as well. Here are a few web resource pages that you can look at as well if you're ever interested in more information. And thank you. My name again is Da-sha Warren. I'm the program supervisor for the Prematurity Prevention Initiative at the Partnership for Maternal and Child Health of Northern New Jersey. If you have any questions or any concerns, please feel free to email me or call me directly. Thank you. Hello. Hi, Jessyca. Thank you for joining me this morning for our Q&A session, going over chronic illnesses and diseases and ways a birthing individual can just learn and more about their health history and advocate for themselves. Thank you for joining me.
Thank you, Deja. Thank you for having me.
Yeah. So we'll just jump in with our questions. We'll start with question number one. So, how can new and expecting birthing individuals best advocate for themselves in a healthcare setting if they are concerned about having a chronic illness and disease while being pregnant?
So that's a good question, right? What we like to tell our clients is to always prioritize open communication with their providers, right? You want them to feel comfortable. You want them to be able to tell the providers their story. Um, if you are aware of a condition that you may have, being well informed, asking questions. If you need to get a second opinion, get a second opinion. And something that's also very helpful is bring a support person with you to the visits because they may have another insight to help the doctors understand your conditions or your concerns, as well as if there's a lot of information that the person is receiving, then maybe the support person can help them, kind of like filter through all of that information and help ask more questions as well.
Yeah. Right. That's great advice. Thank you. Yeah, I think having the support person is definitely a great addition. I know sometimes when I do like education, I also tell like birthing individuals bring a notebook. So if they have any questions, they can jot it down in case they're
Yeah.
just being absorbing like all of the information the provider is saying. Like at least they can write something that stuck out to them and then go back maybe next visit and address that question. So yeah, I think that's
Yeah,
great.
absolutely. And the good idea about having the notebook as well is that I tell my families, like before you go to the doctor's office,
Hmm.
write down your questions because
Yeah.
sometimes, in the moment you might feel a little anxious or a little worried about something that they say, and then all of your questions are out of
Right.
your
Right, exactly. I do that too. Like even
head.
now, I'll be like, I have a question and then forget it once I'm there and then like, oh crap, I didn't write
Exactly.
that down or answer that. Yeah. So yeah, awesome. Thank you. So the next question is, what tips would you give a new and expecting birthing individual to help manage their health while they're pregnant and have a chronic illness and disease?
So, first thing is make that doctor's appointment as soon as
Hmm.
you find out you're pregnant, right? Do not procrastinate like some people, like myself. Um, make your appointments early in the pregnancy. If you're
Hmm.
planning on getting pregnant and you're still not pregnant, start those appointments early as well, right? Start those
Hmm. Yeah.
conversations with your provider that you want to get pregnant or that you're thinking about it.
Yeah.
Start your prenatal vitamins early and take any prescribed medication that you may have already prescribed. So don't stop taking your meds. Get to
Right.
your doctor, discuss your medications. And then, of course, you want to start eating healthier. You want to maybe incorporate some exercise into your lifestyle just to maintain yourself, right?
Yeah.
And of course, always, avoid drugs, avoid
Mhm.
smoking and
Yeah,
drinking if you can, right? Or,
right.
try to find support to help you
Yeah.
stop.
To stop, right? Yeah, that's great. Yeah, I love that you touched about like early planning because I think often, like, even the stories I've heard, like, they're already pregnant, they're already now trying to address like their like health, and it's important, like, oh, maybe even before you even get to like planning or having the baby, thinking about like how can I manage my health before I even think about conceiving. So I think that's also great. Like early planning as well is really important too.
Yeah.
Yeah, I love that. Awesome. All right. So next question. So how important is it for new and expecting birthing individuals to know and then be informed about their family's health history, and how impactful is that information to one's own health outcomes?
So I would say, and I think all providers would agree that it is extremely important
Hmm.
because it can affect the outcome of your pregnancy, right? There could be some genetic risks to yourself or to the baby,
Yeah.
that can be that can worsen because of the pregnancy, right? So it also helps to make a plan, right? So when you come to your provider and you're like, hey, I have A, B, C, D, then the
Hmm.
doctor can make a plan, specialized for you and your care, and and be proactive in managing any potential dangers that may come your way or
Right.
come, for the baby. And then lastly, I think that it also helps the patient make informed decisions about their health, right? Because when they know that they have certain conditions, then they can, be a little more proactive in the
Right.
conversation with their providers about what works best for them based on
Right.
their
Right.
history.
Yeah. That's awesome. Thank you. I like that feedback. Yeah. Right. So, if someone is watching today and was curious about learning about their family's health history, how would you suggest they would find that information?
So, talk directly to your family members, talk to your
Hmm.
grandparents, your parents, your siblings, right? Because especially like older siblings may have seen more things than
Yeah.
you have. Like I said, aunts
Mhm.
and uncles, ask them about their past medical history. And because we're talking about pregnancy, right? Speak to the women in your family about their
Yeah.
pregnancies, what their pregnancies were like, what their deliveries were like. Ask them
Right.
to describe their birth story for you because you'll get a lot of information just
Mhm.
from the stories that they tell. Um, Ask if there were any losses,
Yeah.
because that can also what I tell my families is that this is like a window into your future.
Yeah.
If your mom was dealing with preeclampsia, blood pressure issues, or she had losses because of issues with blood pressure or diabetes, then chances are that you may go through those same issues
Yeah.
yourself. So it's good to know these things just so that you can be well aware of what the possibilities are and you're not so shocked when the doctor says, listen, you have X, Y, and
Yeah.
Z.
Yeah, that's good. I love that you said like talking with the family about like their previous birthing experience because I think that's really important and that does provide a lot of information. Like your mom can be like, "Oh, this happened to me when I was pregnant with you." And then you're like, "Oh, okay, so maybe I'm at higher risk of that happening to me." Or if it's generational, that's also like really important to just know that information. Yeah. Yeah.
Exactly.
Yeah, thank you. All right, so I believe that wraps up our last two questions. Um, so, what advice would you give to a new and expecting birthing individual regarding potentially like how to improve their cardiovascular health during pregnancy and also during that postpartum period?
Yeah, so of course, right, going back to maintaining a healthy diet, exercising, but
Mm-hmm.
always, right, speaking to your provider before starting
Hmm.
any new workout routine or
Hmm.
any like new diets. I know that there are like a lot of diets that
Yeah,
are out there and and things that you can take to help lose weight
right.
before jumping on those bandwagons. Discuss it with your provider because based on your medical history and any conditions that
Yeah,
you may have, some things may not be
right.
good for you to do or to start right away.
Right.
Um, manage your stress levels. I know as a parent with a newborn baby, it's difficult, right? It's a very high stress
Yeah,
time for you, but finding a couple of minutes to just for yourself, take a
right.
long shower,
Yeah,
when a family comes to visit, hand them the baby and
right.
and try to escape and grab a few minutes for yourself to help manage your stress a little bit.
Yeah.
Definitely try to get some good sleep.
Hmm.
Again, with a newborn baby, it tends to be difficult.
Yeah,
But you know what we say, sleep when baby sleeps, take advantage of any time that you may have. The dishes will get washed eventually, the
right,
laundry will get done. What's more
right,
important is your mental health and your well-being, right?
right, right.
As I said, like four more times before, avoiding smoking and
Mhm.
drinking and things like that. Don't self medicate, but
Yeah,
also take your prescribed medicine. Don't ever
right.
stop your medication without discussing it with your doctor first.
Yeah.
Um, and just overall relying on us on your support,
Mhm.
reaching out
Yeah.
to friends and family.
Yeah, yeah, awesome. I love that. And then I know with PPI, we also talk about like self-care a lot, like making sure you can implement some self-care for yourself. I know it can be challenging, but it is very important to do that. And I'm someone, I don't know if anybody watching is like on TikTok, but I'm someone that will like watch those TikTok videos with, oh, take this, and just do it. So I love that you shared, like, don't just take anything because you see it. I'm like
Yeah.
that. And then I'm like, and I talk to my doctor and I'm like, oh, and she's like, you don't even, why are you taking that? And I'm like, oh, because I saw it on TikTok. So if
Yeah,
anybody's watching, don't do
yeah.
that.
There's a lot of misinformation out
Yeah.
there. There's a lot of fads, and
Yeah.
regardless whether you're seeing it on social media or friends are telling you about it, you always before, doing anything that's going to affect your body, discuss it with your
Yeah.
doctor first.
Right. 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 Perfect. All right. Well, this brings us to our final question. So regarding Family Connects, can you share what services your program offers and how families can get connected with a home visitation nurse?
Yes, so Family Connects is a universal home visiting program that provides free in-home visits from
Mhm.
a specially trained registered nurse. When the nurse comes into the home, we will assess the health of both mom and baby. We will assess the safety of the home for any potential complications, help to address any concerns that they may have, and also help to connect those families back to resources in the community based on their needs. So if the family needs, food, and they need support, then we can connect them with any, food pantries, for
Yeah.
example, that would be
Okay.
within the community. And if any families are interested in receiving a visit from Family Connects, they can go to our website, www.familyconnectsnj.org, and they can fill out a self-interest form, and and then we will reach out to them that way. So
Perfect.
any family in the state who delivers a baby, right? So physically delivers a baby, they can adopt a baby, they can foster or be, a family for a guardian for a baby. They are entitled to a free home visit. Um,
Okay.
and in the event that the family has a loss, if they have a loss, the mom
Yeah.
miscarriages, then they can also have a visit as well.
Okay. Awesome. That's so many great like avenues for people to get support. I love that. Like that even if you've adopted, you can still get resources. Like I didn't even know that too. So that's great. And
Yeah,
awesome. Thank you, Jessyca. I appreciate you taking the time to speak with me and go over our questions. I will make sure to provide the Family Connects website link in our recording. And if anyone has any additional questions, I can provide them with your email and maybe connect them to you too.
absolutely. Thank you so much for having me.
Thank you. Thanks, Jessyca. Have a great
All
day.
right. Thank you. You too.
Bye.